All right, so as you can see, Dr. T is here. So Professor Adiel Tel-Oren, aka Dr. T, is a sought-after lecturer and expert in skin health and longevity skin lesions treatment and prevention, clinical nutrition, functional medicine, and laboratory tests. He is introducing non-invasive precision instruments for clinical diagnosis of skin aging with powerful treatment protocols available to all types of practitioners and then us, the recipients. Dr. T is President Emeritus and Professor of Medical Sciences, Clinical Nutrition, and Functional Medicine at the University of Natural Medicine in Santa Fe, New Mexico, and San Dimas, California. He will be lecturing about skin science, the new key to anti-aging. Ladies and gentlemen, Dr. T.
Everybody cares about skin's health. Everybody cares about appearance of the skin. And until now, we have focused mostly on superficial aspects of the skin, such as beauty and longevity and how young do you look and how old do you look. And people occasionally ventured away from superficiality and started thinking about skin cancer and other types of conditions of the skin. But usually they only treated those as skin-deep issues with creams and superficial steroids and with treatments that ignored the underlying cause of skin disorders. People have ignored the fact that when you have atopic dermatitis or when you have an eczematous condition, it's likely to be a result of systemic immune dysfunction leading to inflammation in the skin and probably other conditions that are attendant, that are associated with it, but are typically ignored in favor of treating the symptoms which are obviously visible within the skin. Being that the skin is the most visible organ in our body, we care most about it and we give it special attention. And you'll see that sometimes this attention is actually harming us. In fact, until sometime in the mid-19th century, nobody cared that much about skin in terms of skin hygiene and skin cleanliness. Nobody even thought about germs. We didn't know much about them. And in the days when women who were about to give birth were almost always dying, and sometimes 2/3 of them would die in a hospital, and those few doctors who said, hey, surgeons and obstetricians should wash their hands between patients because we are probably creating some type of contagion, they were ridiculed and died miserable because nobody took them seriously. So from that experience of puerperal fever, which killed so many young and healthy women who just happened to give birth in a hospital, but not those who were giving birth in a home. At home it never happened. But if you went to the hospital to give birth in the cities in Europe, you were deemed as good as dead. And as a result, gradually as information trickled in, and as doctors were willing to actually accept that they were the cause of death of so many women at the prime of their life, only at that time a shift started occurring with regard to skin hygiene. And suddenly there was a push towards different types of antiseptic products with very toxic aspects to them, but nobody cared about that. And then when we saw also who were the people who could afford to look clean, those who had access to water. And usually in Middle Ages Europe, only the wealthy people had access to water on a regular basis and could clean, so it became a status symbol to appear clean. And appearance of cleanliness became godliness and it became something that everybody is now trying to achieve. And immediately in the 19th century, some marketing companies started taking advantage of that, and what used to be an awareness of microbes became phobia of microbes, and later on it became, today, panic of microbes. As a result, companies are selling and actually deceiving the population with their sales tactics, giving us so many products that we put on our skin that are supposedly keeping us clean, but in fact, in many ways, they make us dirtier than we were before. And they destroy some really important components of our skin structure and function, leading to major disruption of our immune system, of our protective mechanism, of our response to various pollutants, and mostly affecting our barrier function, which is the main function of our skin. It serves as a barrier against the outside environment. Every living organism needs a good barrier so that the outside environment will not trickle in and destroy the inside environment. They're very different. One aspect is the dryness of the outside environment on terrestrial environment that we live in. It's dry outside and it's wet inside. We need to avoid losing too much water. For that, we have to have a very tight barrier that won't allow water to go through it. That's why we have a measurement called transepidermal water loss. We want to see if we lost water through the skin barrier, because if we do, we are not functioning well, and that barrier has lost its integrity, which also means that other barriers in our body might lose their integrity as well. It just so happens that all microorganisms on Earth share some similarities with regards to their barriers. They all have some lipid membranes or fatty areas which are very tight and hydrophobic. They don't like water. They don't allow water in. And those have to be extremely dry. So our skin's surface, also known as the stratum corneum, has in it those bricks called corneocytes. And between the bricks, there is cement called the extracellular matrix. And it's supposed to be together, brick and mortar, very dry, lacking water. The lower the water and the higher the fat, the better. And that fat is organized in specific layers, in structures that increase the impermeability of the skin, to not allow any water to go through, and to not allow things from the outside to get in when they shouldn't, not too easily. So the skin is serving as a barrier structurally, but also functionally. The lipids and fats that are secreted by the epithelial cells are then joined by additional lipids secreted by our sebaceous glands, and together they form various fatty structures, free fatty acids, mostly short and medium chain triglycerides, free fatty acids, monoglycerides, and sphingolipids. And those are then converted by bacteria into specific components of sphingolipids and cholesterol and ceramides, which are all protective lipids that maintain a very specific pH, fairly acidic. And that allows only certain types of microbes to grow and to protect us from excessive growth of pathogenic microbes from the outside environment. We must have this layer of protective lipids, and it has to be exactly those lipids. They have to be dry, because if they get too wet, microbes can start growing within them. So if you try to hydrate your skin on the surface of it, you actually increase the risk of pathogenic microbes growing within that wetness. And it's the opposite of what you have been told. We all think that we need to keep washing our face and washing our body and taking shower again and again, obsessively, to be like the upper echelon of society that the Americans and Europeans have grown to like to emulate or to consider themselves a part of. And as a result, we continuously and repeatedly destroy the whole environment crucial for the growth of healthy bacteria and prevention of pathological overgrowth. All of these things are manifested through that one test, transepidermal water loss. Until recently, this test was only available in large research universities, in facilities where they started studying only the skin, not for clinical purposes, but for research value, to understand how the skin operates. Maybe sometime in the future it would become clinically relevant. They only studied the skin with regards to different skin products, where the money is. What type of skin products should be used and how they affect the transepidermal water loss. So they used big rooms in those research centers, and these big rooms had to have very controlled humidity and temperature, because how can you measure vapor when the environment is not controlled? And that's why these type of instruments were only available in big university research facilities and not in any clinic. Practitioners generally did not have access to them. But recently, a company in Finland started creating very small devices that can measure transepidermal water loss. And here is their machine. The whole room that used to be in a research facility is now contracted into this little hole. That's the room. And if you tighten the lips of this room right onto the person's skin, you have a controlled environment. And you can actually measure in grams per square meter per hour the amount of water that has been lost through your stratum corneum. And that tells us about the integrity of our barrier. And this is crucial not just for the health of the skin. It's crucial for everything in our body. As I said earlier, we have some commonalities between the structures composing this membrane in the skin and other membranes in our body, which also contain cholesterol and other sphingolipids and other fatty acids. So if something is wrong with the skin's barrier, something is wrong with other barriers. Please understand that scientists who study the skin are saying that the barrier is the difference between life and death. As long as you have a good barrier between the living cell and the dead environment, that barrier will keep the living alive. Once we start losing too much water, once we have lost our transepidermal water, vapor in large quantities, that's when we are approximating death. In other words, we degenerate. And degeneration leads ultimately to death. So we want to keep this transepidermal water loss to a very low level, the level that we would see in little children, in babies, who still have fairly intact stratum corneum until their parents start washing them excessively and putting soap all over their body, thinking it would protect them, and ignoring that movie, Babies. Have you seen the movie Babies? Where the healthiest children in the world were those who were in the dirt all the time, who were crawling with animals and grass and insects, for whom dirt was their natural environment and not something ugly and disgusting as we'd like to make it into. Those babies did not have asthma or allergies or autoimmune disease. Those babies do not know children's cancer or obesity. They have no immune dysfunctions. They have no behavioral disorders. They have no autistic spectrum issues or learning problems or focus issues. They're healthy babies because they interact with their environment, which keeps introducing them to a huge variety of healthy microbes that protect them. And it turns out that the microbes of the skin, the probiotics of our skin, are just as important as the probiotics of the gut. Everybody talks about probiotics and prebiotics, but nobody thinks about the probiotics of the skin. It turns out that whenever you change this concentration and pH and structure and content of your lipid layer or your fatty layer in the stratum corneum, you destroy the ability of your microbes to do their job. And you will not have healthy vitamin D production. And you will not have any other function that you would expect of the skin. And there are many other functions we won't get into today because you just don't have the time. What we do have is a machine that can tell us what your barrier function is like. Where else do you have barriers? In your brain, the blood-brain barrier. You have barriers every place where you have epithelial cells overlying basal membranes. Not just the skin, but the gut, your glands, your internal organs. Most of them have epithelial cells with a membranous, tight junctioned layer underneath them called the basal membrane or the basement membrane. In the skin, it's called the basal layer, where we develop basal cell carcinoma very often. When we start losing that barrier, we start creating disorganization. Disorganization comes from overexposure to inflammatory components and to dysregulated immune system. When that happens, we have the chances of replication of cells that are disorganized, that could lead to mutations and the formation of cancer. It's not a coincidence that people who have greater exposure, not just to the sun, but exposure to other issues, increasing free radical damage and disorganization in their skin, even in areas where the sun will not shine, those people are at higher risk of developing cancer of the skin, regardless of type. It's just a matter of time before disorganization would lead to the growth of cancerous entities. If the skin is exposed to pollutants, if it allows pollutants in, if it's exposed to pathogenic bacteria, if it's exposed to free radicals from the inside out because of what we eat, when we eat rancid fats or toxic fats, fats that contain fat-soluble poisons within them, that's when we increase the disorganization and allow mutation to occur more rapidly, more frequently, and then it's just a matter of chance. It's probability before cancer begins. All of that and all of those membranes in the body could be tested indirectly through using your skin as a marker. Instead of doing biopsy of your brain, which most people refuse to submit themselves to on a regular basis, unless they already had some brain damage before. Unless you want to do biopsy of any tissue, it's easier to simply use an external instrument that is non-invasive that can be measuring the transepidermal water loss in just a matter of 10 seconds. And then you know in which direction you are going. You don't have to know exactly, but you have to use that as a marker for you to compare yourself against, so that you know that you are improving when you start using specific protocols that will sustain the stratum corneum as a barrier layer. And one of those would be to stop using soap all the time, to stop showering all the time, to stop using hot water with chloride all the time, and fluoride. I always tell people, just shower for as long as you can hold your breath. And you don't need more than that. And avoid using soap on your whole body, maybe just on those very few strategic areas that could end up smelly because they have the apocrine cells, secretions, which means part of the cells is secreted into the sweat, leading to putrefaction. But even that wouldn't be a problem if you have healthy bacteria on your skin. And definitely avoid smothering your body with oil. Oily products like coconut oil, which is really the best oil there is because you can eat it and it's healthy oil. But if you put it on your skin, you are completely diluting your lipid layers. With the wrong type of oil, with the wrong type of acidity, and with the wrong concentration of fatty lipids and sterols and sphingolipids and free fatty acids, it's not exactly the same structure. Plus, you are plugging the holes, the follicles, with the oil. So it's best not to put oil on your skin if you want to maintain a healthy barrier, because it will change the pH, it will change the microbes which are necessary to break down the fats into ceramides and sphingomyelins, sphingolipids, and that destroys the skin's barrier function. Not a good thing. So does anybody want to be tested? Okay, we'll have to do it really fast. Come here, expose your forearm. Now, it only hurts from 0 to 10, 10 is the worst pain you can imagine. It only hurts about 8.5. Oh, sorry, have to do it again. I was just trying to make it hurt less. Okay. Come on. Just when you need to work. What did I do? No, off. That's it. Now it will be. Okay. Don't scream because we want people to have high compliance with this test. Now we want it to be somewhere between 5 and 10, but the lower it is, the better. And it will be interesting to see, in her case, 31.8. That's a huge loss of vapor from the skin. For somebody as young as you, I wouldn't expect that. It means that her barrier is dysfunctional. So we can ask, in this case, whether or not she took a shower today, whether or not she used a lot of soap, whether or not she was in a highly dehydrated environment, especially in the winter when it's too hot inside, which is horrible for your skin, hot inside and cold outside. You always want to equilibrate with the outside as much as possible and wear more clothes rather than heat up everything. Or you might want to have a humidifier in your bedroom and other things of that nature, and then we would have to start talking about what type of fats do you eat, what type of oils are in your food, how many of your nuts and seeds have been allowed to become rancid before you ate them, how many of your supplements contain unstable fatty acids, mostly polyunsaturated fatty acids that can easily become rancid or oxidized. So all of these discussions would lead to improvement of the outside of the skin. Plus there are some products that would help in that, and some protocols and some non-oily substances that are not coating and plugging everything up and are just sitting on top of your lipid barrier. If they contain the appropriate concentration of the right types of antioxidants, can also help reverse this problem within usually 28 days, which is the amount of time it takes for the basal layer to completely be ready for desquamation, for sloughing off. And by the way, the stratus corneum is not a dead layer like it was once thought it was. It's not dead, it's alive. It actually interacts with the rest of your body in amazing ways. All the more to respect it and to treat it with great, great caution. It even has mechanisms and cytokines that help the skin decide when it's appropriate to desquamate or not, to slough off. So you know about this naturopathic approach to brush your skin? Have you bought those brushes? People who brush regularly are the same people who would drink 8 glasses of water a day. You know, following what humans have said is not exactly what nature has said. I have not seen in nature any chimpanzees or gorillas brushing their skin. They pick at each other, they stimulate the skin of each other, but they don't brush the whole thing. Now I'm in the opinion that we should just live well enough alone and don't do anything to the skin, don't help anything. If you want to stimulate the skin and bring more circulation to it, brushing might not be the best option, but just do what in nature you would do, which is horsing around, playing, slapping yourself. You do that anyway to kill the mosquitoes. So do it more frequently and horse around with other people, play it rough a little bit. That will stimulate you enough. Go into the thorns and roll in the hay and be in with the dirt. And then you can just wash quickly in lukewarm water for 30 seconds and you're clean. Because cool water will not destroy the lipid membrane and will not destroy your barrier. So that was just in a nutshell talking about the stratum corneum and how it represents different tissues in our body. And there's a lot more to it that we will discover and explore in a 6 to 8 hour seminar on this topic that teaches people how to use these machines, how to interpret them, and what type of protocols to recommend so people can engage in healthy aging, longevity of their skin, improved longevity of their beauty, but also taking care of the inside, not just the outside. Now the next layer is the layer that used to be called the living epidermis. Until now we talked about the dead epidermis that we know is not dead. But it was called dead epidermis, it's tradition. All traditions die hard, so we call it dead epidermis because it doesn't have supposedly living cells in it. The layer below that is called the living epidermis. It has living cells that have nuclei, that manufacture things, that have ribosomes, endoplasmic reticulum, that generate ATP, cells that actually function and create other cells. That's the living epidermis. And that living epidermis has to be the opposite of the stratum corneum. It has to retain water. It has to be very moist. The more moisture it has, the more protected it is. Remember, we had to have a very dry layer between the outside and the inside. But now you can have a lot of water in the inside thanks to that dry, fatty layer that separates the outside from the inside. If you look at babies, you see that they could have up to 65-70% moisture in their living epidermis. But as we age and lose our moisture, the numbers go down further and further until we are so dry that we can look like we're shriveled up and ready to crumble. And that indeed what happens to us if we don't take care of our moisture level in the living epidermis. It is important not just because of the actual water content and its importance to enzyme functions and immune function, but also it's important because it represents our ability to hold water in any of the tissues of the body that requires a huge amount of hydration by proactively sequestering water within them. For example, the cartilage, the joints. If they don't hold on to water, they erode rapidly and degenerate. And then you end up with joint replacement surgery, bone on bone, eburnation, erosion, and you can see it on x-rays when you lost the cartilage. All of those mobile portion of the body where we don't want friction, for example, the bursae, the ligaments, the synovial fluid in the synovial sheath surrounding tendons, where there is not supposed to be too much friction. That's where we have to hold on to water. And those are the areas that degenerate the fastest in our body because we keep using them, we keep moving them, and that friction continuously creates additional destruction as long as there's not enough water held in there to keep things moist and fluid and sliding and gliding. You all know about hyaluronic acid. There are many types of proteins and long-chain molecules called carbohydrates that are tied together. Some of them are called mucopolysaccharides, and they are designed to hold water in important parts of the body where it's crucial for our health. Some of it is in the living epidermis, but that's not the most important part of the body where we hold on to water. It's actually in the inner organs that we require to hold that moisture, in the connective tissues of internal organs, not just the joints and ligaments, not just in the skeleton. And it's the same nutrients that hold on to water in the skin and also similarly hold on to water elsewhere in the body. So the skin again acts as an excellent testing ground, an excellent organ that is easy to access from the outside without being invasive. Without doing biopsies, we could tell you how well you hold on to the water and how your diet, how your nutrition and what supplements, etc., and what lifestyle habits are destroying that moisture content that you should have. If you lose a lot of water in the skin, you're probably losing it elsewhere in your body, and you're likely degenerating faster. If you reverse that trend and improve holding on to water in the skin, you know that you are moving in the right direction elsewhere in your body. It will take some more time. The skin is faster to replicate and to regenerate, like I said, about 28 days. Internal organs might take several months. In some cases, maybe a year. But as long as you are moving in the right direction nutritionally, you are also supporting the water content in other crucial areas internal to your skin, inside your body. And that is what we measure with the moisture meter epidermis. That one looks in the living epidermis at a level of 0.5 millimeter to 1.5 millimeter below the skin surface. And it is simply measurement of the tissue water percentage. The technology is completely different. The electronics are different. It has a transducer that sends and receives information back from the tissue and measures the percentage of moisture in it very, very accurately. And if you are healthy, even at age 50 or 60, you should have a high level of moisture, at least 55%. 60 would be better. 65 would be fantastic for an adult. So who wants to be the guinea pig? I'm sorry, but to save time, I'll let people in the front, as long as they can expose their forearm fast enough. %. Not bad for somebody who's only 20 years old. Actually, for your age, it should be higher. Just kidding. Have a seat. 55% means, well, she's older than she looks because she maintains appropriate water moisture in her living epidermis. So you're doing some good things. Now, there are different things in the diet that could affect that. And I'm still researching that because a lot of this is brand new and it has never been utilized in clinical setting. This is basically the world's first prototype of this skin science testing kit that is in front of you. And I'm still researching, but I started studying myself and wanted to see what would affect my own moisture content in my own living epidermis. So I started by measuring myself in several locations. They were all decent. And in all of them, I had between 64 and 65%. So I thought, well, that's a good number. But I wanted to see what would affect it negatively. And I experimented with eating a little more protein because I knew that some of those water sequestrants are proteinaceous. Now, because I'm a plant eater, I decided to have my protein source from vegan powders, hydrolyzed rice protein, which is hypoallergenic, but protein. And I increased my protein intake to about 75 to 80 grams per day, which is really high for me. Normally, I would probably get up to 55 grams or 50 grams, which is already a little too much. But I went up to 75 or 80, and the moisture level went down. So too much protein in your diet actually destroys the longevity of your skin, which explains, that's probably because of all the free radicals that come from nitrogen residues. Nitrogen free radicals are very tough for the body to handle, and they cause a lot of degradation to fatty acids, including those which are present just underneath the skin in the subcutaneous layer. So too much protein was a problem, maybe because it has other components within it, but I was very interested in that, and it kind of explained to me why some people I know who were very young and relatively healthy in their age of 30 or 31 came to my clinic with skin cancer that suddenly occurred as soon as they started eating a lot of protein, changing their diet when they heard about some diets that are out there that espouse high amount of animal protein on a regular basis. And I'm not trying to create arguments here. I'm just telling you about the experience. So when people join an organization that says, let's eat traditionally, and the tradition is just the tradition from a few hundred years ago, not tradition of humans 150,000 years ago, it's a short-sighted approach which does not really look at what humans ate in nature. And those people suddenly look older. Suddenly the skin starts aging, and in some cases I see skin cancers happening very early. So that is a result of disorganization of the tissue from so much free radical damage. Also, most people are not eating enough mucopolysaccharides containing foods, which are the succulents. How many succulent foods do you eat on a regular basis, such as cactus, aloe vera type leaves, plants that grow right next to the salty environment of the sea, right at the tide line? There are a lot of plants that are highly succulent, rich with mucopolysaccharides, which are designed to hold water in the face of the salty environment outside. Because the water that is salty has osmotic pressure, taking water out of the body in an accelerated fashion. So the body has to protect itself with mucopolysaccharides underneath the surface of the skin, just like those plants in salty water. And part of our evolution was in salty water environment, at least to some extent. So we developed these mechanisms that were tightly connected with the types of food that were available back then. Kelp is a good example, dulse, and many other mucopolysaccharide containing seaweeds that would wash onto the beach, and we would eat them with great enjoyment because they're salty and they're mucilaginous, they're chewy, they're satisfying, a lot of calories, and you get from them the nutrients that are not easily available elsewhere. The sulfated mucopolysaccharides, sulfur-rich mucopolysaccharides, they are crucial for many aspects of our health. And sulfur, as you probably heard me in some of my previous lectures, sulfur is crucial for detoxification, for youthfulness, for holding together not just the DNA, but also the hair, skin, nail, cartilage, connective tissue. Most people don't have enough sulfur, especially in our polluted environment. That's why I tell everybody, get that sulfur-rich salt from the Himalayas, because it gives you non-stop sulfur whenever you eat. I don't even bother using other salts. I want to get sulfur every opportunity I get. And the salt becomes a good source of that. And it gives you more sulfur that would also help your skin keep the hydration. But definitely eat more seaweeds if you can. And if not, you'll have to eat other sources of mucopolysaccharides, or help your body manufacture them and destroy them to a lesser extent by lowering the free radical damage that occurs in your living epidermis. So this is a very important test. I have seen people in their 20s who already have the moisture level of somebody I would expect in the 50s. And the good news is that you can improve it within a month. Again, it doesn't mean that you improve it in your joints. It would take a lot longer, but you are moving in the right direction. And you can only compare yourself to what you were before. Don't compare yourself to other people. Every time you do something that is off the wagon, every time you go in the wrong direction, you will see it affected in the wrong direction as well. So this can be a guideline, a very quick and inexpensive way to quickly figure out if you're in the right direction or if you are harming yourself and losing your water. And by the way, people who have very, very poor barrier function obviously will lose more water, because that's what we're measuring, transepidermal water loss. But I have seen people with a horrible stratum corneum who had very good water moisture level, because they held onto those humectant, or those molecules that hold onto water, that sequester water. They held onto them very well and they didn't destroy them. They just destroyed the outer layer, maybe because of excessive exposure, too much dryness, too much sun. I mean, I'm talking about burning in the sun too often and too much, or destroying the stratum corneum through excessive showers and cleaning materials, alcohols and antiseptic products and microbiocidal products that people put on their skin. And that's why only that could be destroyed, but the inner portion could still be relatively good. And by the way, the stratum corneum also has the function of using those very specific lipid structures in the right concentration and thickness to allow filtration of the correct UV lights, so that you can make the exact amount of vitamin D that you need and protect yourself from the UVA radiation that could actually accelerate aging, degeneration, destruction, and death of your skin. Now let's go one layer further in, the layer of the elasticity of the skin. That's already the dermis. We go deeper. The dermis is where we have the collagen, the elastin, and other structures that depend on vitamin C and different types of amino acids that have to cross-link, and the level of your antioxidants. All of those are crucial for elasticity, which keeps things bouncing, which keeps your skin holding up against trauma, so that you don't bleed as soon as somebody punches you in the cheek because there's no elasticity in the skin and you hit the bone right away. Or so that when somebody hits you in the belly, there is some rebound that protects a little better the internal organs. There are many reasons for us to want to have elasticity, and the list of them is that we want to look young. But when you have a lot of destruction in that collagen layer and elastin level, you also are destroying, in the same manner, some crucial elastic portions of your inner organs. Where do you need the highest elasticity? Inside your body, in the most important, obvious place. Vascular resistance? That's what you said? Yeah. The blood vessels have to dilate and then they have to contract again. Every time there's a bolus of blood pushing through. That's elasticity. Very similar to the elasticity of the skin. Like I said before, the skin represents almost your entire body. But where is even more important immediately? Think about every second something that you do without even thinking about. Breathing. You fill up and then you let go. You don't push the air out, it comes out by itself. That's because of the elasticity of the lung. It expands, then it contracts. That's elasticity. We have elasticity in most organs of the body, and we need it. But yes, it's true that the blood vessels are crucial, the lungs are, and also many other components of internal organs that are there for protection and for rebound, to avoid trauma to internal organs. Also, we have some elasticity in our muscles and in our tendons and ligaments to some extent. And our joint capsules are slightly extendable and rebound. All of those can be represented by the elasticity of your subcutaneous tissue, the dermis. And this machine measures it in newtons per meter. Now you remember, newtons are a measure of force. So this is a completely different technology from the other two machines. It has a little knob which can be pushed in, and it measures the pressure in newtons of the pushback after doing it 5 times on the skin, and it measures automatically the average of all 5 to give you a fairly good average of elasticity of your skin. So who's going to measure their elasticity? Come here, Susan. Best for last. You have to expose the same place as everybody else and stand in front of the camera and smile. Okay. Okay. Her number is 82 newtons per meter. That's not bad. For her young age, it's actually very good. You have good elasticity. That's one thing you have kept. I'm curious about the other 2 parameters in your case, because it's not always corresponding. Some people have really good elasticity, but bad barrier function or bad protein holding of the water. But that's very good. This number I have not seen a limit to yet. When I measure it in babies, I can see 150 newtons per meter. And in a 12-year-old and 15-year-old, I could see 120, 130, 110. And then as you age, of course, the resistance and the rebound diminishes, and you end up with 50, and sometimes I see 25, 29-year-olds with a low level of 40 or 45. So 82 is not bad at all for anybody who's above 40. Yes? Well, then I'm really sorry about this result. It's good for you to know, again, to compare with yourself and not necessarily with your age group, but at the same time, it's good to know what I would regularly see with certain age groups, so you can compare yourself a little bit, see how you do, and what you've done to yourself until this point to merit a good grade or a bad grade. And it's sometimes a good party thing. Instead of doing Botox parties and all those horrible things that people do, you could just do a skin testing party and have a bragging right that you have better newtons per meter elasticity than other people. You know, isn't it something nice to compare? You know, hey, my transepidermal water loss is far better than yours, you know? And say, I'm only going to date somebody who has transepidermal water loss of, 7 and below. Those are very nice ways for people to relate to each other about something that could lead to a healthier lifestyle, improving the level of antioxidants in your diet, reducing the level of inflammatory components in your diet, because inflammation destroys and degrades the living epidermis and the dermis, and the subcutaneous fat as well. So you need to avoid inflammatory foods, and each person has a different cause for inflammation. Some of you are reacting to sesame, and some to garbanzo beans, and some to gluten, some to corn, and some to all of the above, and some just to soy. So inflammatory foods are not one size fits all. You want to reduce inflammation, and I recommend testing so that you can find out whether or not you are sensitive to something and increasing the inflammatory response whenever you expose yourself to that food. Just like I would recommend to see how your absorption, digestion, assimilation, and inflammation are in your gut, because if you have gut inflammation, you're likely to have inflammation throughout your whole body. For example, if your zonulin level goes up in the stool, you have leaky gut syndrome, which is associated with increased autoimmune flare-ups in your body, which is leading to complete mayhem and inflammation and free radicals everywhere in your body. So you want to do some tests to find out what is really happening, rather than just believe somebody who tells you it's a one-size-fits-all. Each person has different triggers, different mediators, and different susceptibilities to different environmental and nutritional factors that could lead to inflammation, which will then destroy your skin and your other tissues. And you want to eat foods that have been the least processed, so they have the highest nutrient density. Enough of those boxes in the supermarket, enough of those wraps, enough of food that have long shelf life. Superfoods are generally a marketing scheme. Superfoods come from the supermarket. Real foods come from the real market. And people don't buy enough of the real foods because they don't know what to do with them anymore, and they rot in their fridge. So make sure you start incorporating some real food into your diet daily. Buy the food and spend the 10 or 15 minutes it takes to prepare them, and make sure that a large amount of them is in its raw natural state, and only a little bit of it is exposed to higher temperature, and definitely not excessive temperature that would lead to the formation of horrible inflammatory and free radical agents called advanced glycation end products. If you do all that, your skin will thank you. And I noticed that whenever I changed my diet, and when I have changed it, suddenly I could be in the sun a lot longer, because my skin barrier was functioning so well that it filtered the rays appropriately, and I could be in the sun 3 times as much without even getting burnt or red. Everybody can do that. You can be in the sun as much as you want, almost. It can be a great revelation that the sun suddenly is your friend, and your opportunity to protect yourself from various types of cancer that are far, far worse than those negligible cancers that don't kill anybody, like carcinoma. You know how skin doctors tell you to stay out of the sun and to smother yourself with sun protection product, which also destroy your skin and add all those poisons to it and destroy the barrier, and allow you to stay in the sun a lot longer while poisoning yourself and increasing the risk of all those skin cancers. And all that just so that you avoid those negligible carcinomas that don't kill anybody, to the point that it is far, far better to have carcinomas on your face than not to have any sun exposure, to the point that studies have shown that people with carcinomas on their face have much higher longevity and lesser morbidity than those who don't have carcinomas. Yes, it's better to have carcinomas on your face. I can easily take care of them, by the way. I can easily remove them. With my method, it's so easy to remove carcinomas without surgeries, without pain. Instantly, you can remove 20 of them without ever worrying about the word skin cancer again, because it's so simple and easy. But even if that method did not exist, skin cancer like carcinoma rarely kills anyone. I'd rather have that on my face than to have no carcinomas at all because of lack of sun exposure, which would lead to twice as much colorectal cancer and twice or 3 times as much so many other types of internal lethal cancer and all the other immune disorders of autoimmune disease and suppressed immune system and recurrent infection and obesity and depression and other symptoms that are far, far worse, that affect our quality of life so much more dramatically. And that's the result of listening to the skin doctor's advice. They are creating an epidemic of so many diseases and cancers just to protect us from this non-entity called basal cell carcinoma. Plus, they cause a much higher level of melanoma. Much higher level of melanoma because have you ever seen a melanoma on your face? Melanoma never happens where the sun shines all the time. It only happens a lot where the sun does not shine. So again, the skin doctors have created a huge epidemic of melanoma that only they benefit from. Reminds you a little bit of those firefighters who didn't have enough work to do, so they started arsons. They went into arsoning. Is that what you say? Yeah, they started creating their own fire. Pyromaniacs. They create fire everywhere so that they can be the heroes who save the day when they come to the rescue and put out the fire. Well, this is exactly what the skin doctors have done. They created an epidemic of melanomas that only they benefit from because now they are coming to the rescue, heroically trying to save you, and often failing. If you see how many tens of thousands of people die every year or suffer severe disfigurement, only the skin doctors became important because of their own advice. I tell people, everything that could become a melanoma 20 years from now, get rid of it now. It's easy. Just peel it off. Simple to peel it off. If you have 30 tiny black lesions that can become melanoma in 10 years or 15, just get it, take care of it now. You'll never have a melanoma because there will be never melanocytic cell that could convert into melanoma, and that's it. And you can enjoy the sun to some extent without excess. The more you treat your skin appropriately, the more you take care of your health, the more you can enjoy the sun and be a friend with her. I think that the sun is a female. But maybe to some of you it's a male, I don't know. We want to enjoy the sun like we used to in nature, but not to excess. And not to listen to man-made ideas. Just to natural ideas that indeed represent what nature intends as a part of our evolution towards the healthy, optimal physiological status that we all deserve. Thank you very much. Any questions?
Will you accept appointments to do all 3 readings?
At the moment, I'm not doing that because I want to train a lot of people to do that. So actually in the Bay Area in early May, we will have a 6 to 8 hour seminar dedicated to this skin. 3rd of May. A whole seminar of 6 to 8 hours dedicated to learning how to measure, how to test, and people who want to use that in their practices. It could be nutritionists, life coaches, it could be doctors, it could be anybody. It could be even beauticians, because it is so easy to test. And those people would be able to then offer protocols that are based on science. And I'm not working on it by myself. I'm working with Dr. Nava Dayan, who is one of the world's foremost skin scientists, who is the editor of a very large compendium of most recent scientific information about the skin, which I relayed to you today to some extent, but we will go into much greater depth when we do that seminar, and then you'll be able to implement the different protocols to improve circulation to the skin, to improve the barrier function and the water retention and so on. So I don't want to do it myself because I just don't have the time, and I want to finish with the preparation of all the protocols so that the testing will be more valuable. And I'm doing still a little bit of research so that I could have better comparative findings between different age groups and populations.
So we need to work with the live streaming here. So actually, Dr. T, since we only have one mic, for efficiency's sake, can I have you go ahead and run the mic into the audience, and then you'll be closer to the mic, so I won't hand it back.
So I'll have some exercise. Susan, do you really need another question?
Correlation between the skin barrier and the blood-brain barrier and the gut barrier.
The correlation has not been conclusively proven yet because it hasn't been studied. But any place in the body that depends on certain nutrients is likely to have the same resource, the same amount of nutrients that are designed to be distributed among all the organs that require that nutrient. If one organ is lacking in these nutrients, it's very likely that the others that require the same nutrients will also be lacking. It's just simple laws of thermodynamics, if you will. If you don't have enough, it will be shown in all the places where it's required. And therefore, physiologically, we have to assume, logically, that there will be a correlation. We don't know exactly to what extent. We know that the body does have preferences, but if it's lower in the skin, and the skin is not as critical to our immediate survival. So if we have a lower level on the skin, we know that the body is retaining it somewhere else. There's a good likelihood that in other places it's starting to have some shortages as well after a while.
What is the best diet daily for better skin and health, and would you recommend any nuts to eat every day, and which is best?
How to ask 10 questions in one.
And alkaline and acidic foods.
By adding and. Okay. Rather than spend 2 hours on each one of the questions, first of all, I have some CDs and DVDs. There's a DVD of 2 hours talking about pH, alkalinity, and it busts some of the myths out there about pH. Obviously, eating foods that result in lesser acidification within our tissues is a good thing. Well, I'm not saying alkaline because it's not exactly an accurate terminology. I'm saying reduction of foods that increase acidity. Okay, that's more accurate terminology. But that's true on many levels. I mean, I want people to eat nutrients and not just to think about pH. There are so many things. If you email my assistant at clinic@ecopolitan.com, you can ask her for the top 10 foods. Oh, it's over there. There's a little booklet of that too. But the top 10 foods is a whole chapter. It's also an online lecture that's available for free on YouTube. Or just go thetruthaboutyourfood.com. There are 12 hours of free lectures. And one of them is about what foods to eat. And it's mostly, and I'm not telling people to follow any dogma, but mostly you want to sustain an essentially plant-based diet as much as possible, because that's where you get your fiber and all the antioxidants, and avoid a lot of the excessive proteins, and today many of the toxins that accumulate, the fat-soluble toxins, and also the preparation which leads to so many carcinogens. So in general, I'm not telling people to be 100% anything, and I shy away from using dogmatic terminologies or terms of people, because I don't want to form camps, or we are this and they are that. But in general, you want to have more and more plants, and if you want to eat animals, it has to be a very, very small percentage. And it has to be very, very clean, and it has to be what you would have eaten in nature, like termites. Termites. Termites are just as good as nuts, by the way. No, termites and other insects, grasshoppers are great. Grasshoppers are delicacy, and they are delicious and nutritious. You know, but you would normally eat no more than 5% of your diet in grasshoppers. You can also eat snails, shells, clams, lobsters. You know, the cockroaches of the sea are also very common and easily available and easily captured. Today they are a little toxic with heavy metals and other PCBs and other compounds that you don't want to overdo. So again, you go back to more plants, and don't forget the seaweed we talked about earlier. And yes, nuts are good, but they must be raw, refrigerated, or frozen until you eat them to avoid rancidity, and they should never be roasted. And don't believe the people who sell you superfoods, which are sprouted, soaked nuts that have been dehydrated. What's the point? You take a nut that is perfectly good, and instead of eating it, or soaking it in the fridge if you absolutely have to, and then eat it right away, you soak it, allowing water to come in, meaning you are creating a breeding ground for rancidification and oxidation, and then you put in a dehydrator, which will destroy anything good that was left in those fatty acids that were in those nuts. And they are sold as superfoods for a lot of money. So those I would never touch. They really harm your skin. But definitely eat coconut oil and avocado and other stable monounsaturated and saturated fatty acids, which will resist oxidation.
Do you still favor, for example, in terms of cleaning, glycerin soaps over non-glycerin soaps and soaps over detergents?
If I had to choose a soap, it would be the most natural oil, like coconut oil type soap that has been saponified and nothing else. But even that is destroying the lipid membrane, the lipid layer of your stratum corneum. So even that I would not use. Only on my armpits, just in case I want to be social, which doesn't happen often. And also in my crotch region, although it's always smelling like roses, sometimes people might not like roses. So in that situation, I might use a little bit of soap just in the crotch area, and that's it. And I promise you, I do it for a shorter amount of time than I can hold my breath.
How does exercise affect the moisture of our skin?
The question is, how does exercise affect the moisture of the skin or the health of the skin in general? If it is exercise as nature intended, which means it is not excessively stressful, ultimately very stressful exercise leads to inflammation and to depressed immune system. But exercise that is mostly movement and occasional sprinting or occasional intensity is very good for the circulation. When you bring the blood close to the skin, and there are many ways to bring the blood to the skin, not just walking, but also slapping the skin, stimulating it, eating foods that are naturally healthy for the circulation, avoiding food that will cause inflammation in the blood, and also machines like the BEMER machine that helps increase the circulation in the capillary or the perfusion. So all of those are very good for the skin in general. Again, you bring it from the inside out. And stress is horrible. So you have to fight stress whenever you can, or do whatever you need to, whether it's meditation. I teach people to do my own scientific rendition of meditation that helps people open up their blood vessels peripherally more effectively than other forms of meditation that I've studied. So many things that can improve the circulation.
Just curious if you have any clinical trials or anything published on either the apparatuses or your protocols?
I personally had no time to do my own clinicals, but there are already other clinicals that were done, and I'm collecting them as much as I can, using both knowledge of physiology and simple logic. You know, there are no specific studies that correlate the level of exercise, for example, with the health of the skin, because until now there weren't sufficiently easy parameters to utilize to measure things in the skin. Now we have it. Now is the time to do the research. But until we finish the research, we already know what increases the circulation of the skin and what reduces free radical damage of the skin and what maintains the health of the stratum corneum, and we can easily see that. And we know that the stratum corneum is designed to be dry, so we do whatever it takes to improve on that dryness. And we know what it takes to improve the humidity or the moisture content, so we work towards that, and we can measure the results instantly. So these are protocols that are evolving, but they already are based on sufficient science that existed. So far, nobody could have done sufficient research with these machines that are fairly new.
Are the protocols diet-based, or are they thoughtful?
Combination. Yeah, we're going to use everything we can to help people, but they will have to decide for themselves to what extent they want to invest in their own body's health. I mean, right now, you are getting a chance to look through a certain new window into your degenerative process that you never had before. Until now, anti-aging was some type of a guesswork. Somebody made a promise to you that if you do certain things, logically you would live a little longer. But there was never a proof of that, yet everybody flocks to anti-aging conferences. There is no science. There's only biochemistry and physiology that makes sense, that we assume will do some good. But now with these instruments, we have a very easy parameter to investigate repeatedly, rather than taking the blood repeatedly, which most of the blood tests are not very direct. Of course, vitamin D level that's high and homocysteine level that's low are indicating that you're going to live a little longer because you have less inflammation, for example. So we know some parameters that we could use, but it is invasive and more expensive to do on a regular basis. Whereas here you have parameters that are quick and easy and reveal to you what normally you would only find out through a biopsy. Sorry.
So what is your opinion on itchiness on dry skin? Whereas when you apply coconut oil on your skin, then itchiness goes away.
So what happens once you start putting oil on your skin? And this is really important, and I'll give you a very simple example. Have you ever put lip balm on your lips? Did you notice what happened? As soon as you forgot to put it on, your lips were the driest ever, and you felt like you have to find that lip balm. But you never felt that way when you didn't even know what a lip balm was. As soon as you put external oils on your skin and destroy your own barrier, and this barrier goes into the mouth, and the oral mucosa is a direct continuation of the epithelium of the skin. It shares many of the same immune components. As soon as you destroy that barrier and start losing stuff through it, it gets degraded and you get quickly dry on the surface. So it is the very oils and creams and substances and lip balms and so on and moisturizers that you put on your skin that cause it to depend on the same moisturizers and products, and that's how the companies get you coming and going. They make you an addict to their own product, and you have to keep coming back for more, not realizing that they have created that need in you. So if you avoid putting it on, that oil, and you allow yourself to itch a little bit and have somebody next to you slap you on the area that itch, to be really good for you. Felt good, didn't it? Okay. All right. Start slapping where it itches. Bring more circulation in there. And by the way, if it itches for other reasons, there are many other pathological reasons for excessive itching. So find out that you're not in one of those criteria. And then see what happens. After a week or 2 weeks, suddenly you will need less and less because you start building up your own your own lipid membrane over the skin. And if you avoid too much showering and hot showers especially, and all the soaps that we discussed, perhaps your skin won't be so dry and itchy after all. And there are other reasons. Sometimes people are sensitive or have allergies or have autoimmune diseases, which also lead to that. Some people have neurological issues. Neurological issues can also lead to sometimes to itching. Even lymphoma could lead to itching. So there are many reasons why a person itches, and using a temporary fix like oil on the outside might reduce it, but will cause additional harm and dependence into the future. Find out the cause rather than just mask the symptom, and take good care of your skin. It might take care of itself if you just give it a chance. Okay?
Okay, so your skin looks great. So what's your secret? So, so you're saying no oil, so just water? Just purified water?
You mean orally, or you mean... I don't wash my face. Yeah, I don't wash my face. What is that about? Who invented face washing? I don't know. I mean, I haven't seen the need for that. Is it because you need to wake up in the morning? You feel like you won't be awake? You can be awake in the morning without washing your face. I don't believe in that stuff. You know, look, if the water runs for a second, a little water, it's not a big deal. But people go through a whole routine, a whole ritual with all those products that they spend half an hour with their face every morning. They become totally hooked, and they destroy their own face. I don't do anything. That's my secret. I don't do much of anything. I don't fuss too much. I don't have time for it. But people who fuss a lot end up needing more fussing to undo the damage of the previous fussing. Right? Just be a little more lazy, please, and a little less hysterical, a little less panicking and phobic, and allow nature to take over and be closer to nature. And don't be afraid. You know, it's fear. It's listening to all those pieces of advice that make people use sun protection. You know, I don't think I've ever used SPF product. Here's another thing. That's another secret. It's all don't and don't and don't. It's not just the do's and do's. But if I had the problem, I would probably do more. I would look for stuff. I would put antioxidant on my skin and so on. But my skin so far protects itself fairly well because it has the tools, and you have the tool too. You just need to give them a chance. And then you'll have some of the protocols that we could use to accelerate it if you wish.
How about redhead people who have very white skin? Do they have the same protection?
Are red-headed people having the same protection? Their skin has their same natural protection. However, because of their insufficient pigmentation, they would be less time in the sun before they start having inflammation and redness. That's why there's no one-size-fits-all. For some people, being in the sun 10 minutes, front and back, is all they can do. Until after they've done it for a few weeks, they can go up to 15 minutes or to 20 as they build up a little more pigmentation for protection. But if you cannot make any pigment, you might have to resort to stay 5 to 10 minutes, and that will be enough. Because the lesser the pigmentation, the more vitamin D you will produce in a very short amount of time. So you don't have to be in the sun that long. You just have to avoid being in the sun long enough to get red. So that's appropriate for everybody. The rest of it, the discussion about the stratum corneum and the moisture content and elasticity is true for red-headed people as much as it's true for African American. Did you already ask the question before?
So, as a woman, I use makeup, and I do not see myself stopping using makeup. So, what do you recommend?
Become a man. I mean, that's the only advice I could have. If being a woman is the reason to put makeup on, that's the only logical answer I could think of.
It's very easy for a guy not to wash their face, but as a woman, using, like, it's very natural for us to do that.
I'm a feminist, I'm sorry.
Well, I'm not going to give it up. So,
Okay.
if I'm not going to give it up, I'm just asking, like, what are some of the things that you would recommend to do?
If you insist on harming your face on a regular basis, I guess you would have to have the most perfect diet. You would have to put some type of an emulsified product underneath it to serve as some kind of a barrier, not to allow the toxins in as much. You'd have to clean that without using so much soap as to dry your skin completely. Notice how young teenagers who have perfectly healthy skin, as soon as they start putting makeup on, they get hooked to the makeup because they look horrible without it, because it destroys the skin. So I'm willing to bet that if you spent a week in the tropics without any makeup on and allowed a little bit of flushing to occur on your face, just, be sun-kissed, suddenly you'd be a lot more beautiful than you are now without using any makeup. Would you agree? Yes. All right, see? You have all the women here agree. Yes.
So I have two questions. The first question is for people that are on cholesterol-lowering drugs like a statin, because systemically they're making less cholesterol. Does it affect the barrier function because cholesterol is part of the essential lipids in the extracellular matrix?
So I assume the question is, what happens with statin takers? And my answer is, they should stop taking statins, because statins are one of the worst things you can do. It increases mortality and morbidity, increases cardiac arrest, it increases cancer. And it just poisons your liver for no good reason. Cholesterol is not the problem. Cholesterol is just a part of a bigger picture. And we need cholesterol. The skin requires cholesterol. Without the cholesterol, you won't even make vitamin D, which comes from a cholesterol derivative in the skin. So people who take statin drugs are basically sheep led to the slaughter. And they're basically allowing the cardiologists to have their way. And there is no scientifically valid reason to take statins, in my opinion, and also in the opinion of many, many researchers. And there are many books by preeminent cardiologists who also say the same thing. But for some reason, they're ignored by mainstream, which depends on the money-making statin drugs that are supplying all the journalism, all the newspapers with big advertisements. So everybody is silent about it, and people are still being destroyed. Their health is still being destroyed. And before I forget, I want to also mention that on Saturday, this coming Saturday, in 2 days, I'll be giving a 3 or 4 hour seminar on electromagnetic radiation and fields and how to protect yourself with using science-based approaches that would reduce your exposure to at least 7 or 8 types of electromagnetic exposure. So if you want to attend that seminar, which will give you everything you need to do what you need to do, even saving a lot of money while at it, and it's all really based on physics as opposed to wishful thinking. Talk to Anna about that. Yes. Oh, I already answered that question. You had a second one. Or let's give somebody else an opportunity.
You consider like gum is skin? Like, you know, everybody's supposed to brush teeth every day.
The gums are an epithelium. It's a mucous membrane, which is a stratified squamous epithelium, which is made to handle stress. Just like the skin is also stratified squamous epithelium, meaning it's layers of very, very squat or thin and elongated bricks, which is necessary to protect against friction. The mouth is a place of friction whenever you chew on hard food. So there is definitely a lot in common between the mucous membranes of the mouth and the skin around the mouth and outside of it as well. And it's one continuum, and that's one of the main sources of probiotics for our gut is the skin. They move in. That's a good thing. And if you keep washing obsessively everything that falls on the ground, you're missing an opportunity for some really good microbes. Really. Don't be so clean. It's okay to wash your hands after you just stuck them into some woman's belly to take out a baby, before you go to the next pregnant woman to do the same thing. Then it's okay to wash your hand, because you don't know what you're transmitting from one to the next, and it's a very susceptible environment in the hospital. Brushing teeth? Well, you know, I'm not brushing the teeth all the time, but I stimulate the gums. You need to stimulate the gums as much as you can. And, you know, clean the teeth a little bit, because nowadays we eat foods that are sticky and calorically rich and fibrous poor. So we don't have as much of the action as we would have had in nature. But brushing the teeth, that's from the 40s. That's from the 40s. That's from the 60s. Nowadays, we don't even do that. We just vibrate it at the junction between the gums, at the sulcus, and the teeth to stimulate. And we also use sharp edges of rubber to go in between and to, again, get in there where the dental hygienist would get in there, to cause a similar type of pleasurable pain.
So one more question, and this man's been holding his hand for a while here, so.
On your instruments, are the readings consistent on different parts of the skin, or do they give different readings?
Obviously, different parts of the skin will give different readings because of the thickness of skin, in which each varies in different places. That's why there's a standard, and the standard is in the mid of forearm, in the area that's not hairy. That's why I measure right here. But for research purposes, I have measured several other points in the close to the wrist and up to the shoulder and on the biceps, and I saw that there are small variations, not too far off, and those variations are fairly consistent.
But if you normalize for density, they come out to be fairly the same?
Between individuals?
No, I mean on an individual, if you normalize for density of the skin, does it come out to be a similar reading?
Yeah, so he's asking if we normalize for the density of the skin, if we would have the same results more or less. I haven't done that type of a calculation. It makes sense that it would be, but it also depends on the level of exposure and the amount of sebaceous glands. Sometimes you have a very thin skin, but much more sebaceous gland, as in some places on the face or on the chest or on the upper back, the area that are more prone to acne. So it will be different in terms of oiliness. That's why we have to be consistent among all the people, and that's why it's always the same spot. Okay.
Let's give Dr. T a hand.